Hey guys, welcome back to Talk Story with me, Gaven Sugai. I am here with the founder and owner of AlohaMass.com as well as Wilson Care Group, Shelley Wilson. Thanks for joining us on the show today.
Thanks so much, Gavin. It's great to be here. Thanks for having me.
Yes. And you do quite a bit of things, especially during this time. This is actually a very important time, and we need people like you. But we'll talk about that in just a bit. Let's talk about from the beginning, Wilson Care Group. How'd you get that started, and your whole purpose behind it?
Yeah, thank you so much. I've been in business now for 25 years, and my first company that I started here in Hawaii was Wilson Home Care,
Mhm.
and I started when I was 21. And the reason that I started that business was because I was previously injured in a pretty serious accident while I was serving in the Army.
Mhm.
And I ended up in a wheelchair for a couple of years. I had a knee replacement, my right knee, and my left arm was very, very badly
Mm.
broken. And they were, and at some point, going to amputate my left arm. So opposite
Mm.
leg, opposite arm, and stuck in a wheelchair for a few years. So when I came to Hawaii after that experience and my family trying to take care of me, it was very, very difficult for them, and working, and I was at home and lots of doctor's appointments. So I decided that I'd start this company where individuals could come into your home and provide services and care. And it was really born out of my own personal experience with my family. And if I would have had that, it would have been a huge relief for my loved ones and also for me. And
Mhm.
I think one of the funniest things about when you are sick or when you're injured or you're not feeling well, we're really awful to our own loved ones. And it's easy to get grumpy. And, I remember my sister having to wash my hair and give me a bath. And I was awful to her. I was so awful. But I'd go to the doctor and I'd see someone I've never met before, and you're just on your best behavior. You're so nice to strangers, but it's so easy for us to be grumpy with our own loved ones. And I think that you're a lot more just maintaining the relationships that we have with your loved ones. It's healthier that way
Mhm.
when you're down and out and you're not feeling well. But we've been very fortunate. I have a fantastic team at Wilson Home Care, and the last 25 years we've taken care of tens of thousands of residents and friends and family members in Hawaii, and really, really, really fortunate. So, and then in 2007, after a lot of our patients needed alternate resources, 24-hour care can be quite costly for individuals. So lots of family members needed other types of models for long-term care. And so I built a care home in Kailua, Wilson Senior Living, for 22 residents. And so that's a sister company to Wilson Home Care. And we also, besides taking care of a lot of kupuna, we take care of children, pediatrics. We have
Mm.
little ones that we care for, skilled nursing, general, basic activities of daily living at home with caregivers, but also we have a great program for the wounded warriors in Hawaii across all of the islands. As a disabled veteran, it's really, really been important to me to make sure that we're taking care of our veterans as well. And we have a pretty large population that we're really privileged to care for.
And that's amazing that where you came from, because a lot of my viewers know that I've had a really bad leg injury, and I always make a post about it on the day of the accident too. So to come from that experience and to to really grow a business that's very intentional, purposeful to what it is now. That's amazing. And the fact that you started from a young age, I mean, that that just helps with a lot of young entrepreneurs to know that you can really get to the a good point where they can build their business as well.
Yeah, I think a lot of people, a lot of young people, I in so many ways was fortunate to
Mhm.
have this horrible accident when I was 18, because it was such a life-changing experience. And I'm sure for you as well,
Mhm.
with your accident, it's a life-changing experience. And
Mhm.
when you're in that place where you have to be really introspective while you're healing and going through that process, and your journey in being injured and coming back from that. And
Mhm.
it's different for everyone, but I also had some significant facial injuries, and so
Mhm.
I couldn't see for a while. So I had multiple fractures in my face. So I
Mhm.
think that also, I wasn't able to watch TV, and just having to be with yourself for a long, long time, and having a near-death experience. I think it takes a lot of our maybe the human aspects, that we're afraid, the fear of doing something, the fear of starting something and failing.
Mhm.
When you go through an experience where, it was near fatal for me, um, everything in my life then was benchmarked against that. Like, what's the worst thing that's going to happen? I'm not going to die.
Mhm.
So why not try? And, starting a business, I think, is really scary for some people. And the older we get, the more financial obligations we have, or responsibilities. But, being young and surviving that near death experience, I think at 21, I had no fear of failure. Like,
Mhm.
there's nothing but opportunity. And if you don't try, you won't know. And I think we are our own worst enemies sometimes in wanting to do something, or having ideas, or you have inspirations, but we don't act on it because of
Mhm.
all of the voices in our head that tell us bad things could happen.
Mhm. I totally believe that too, because even with my whole leg injury, I probably wouldn't have started a podcast, or we probably wouldn't have met. I don't know
Yeah.
how life would have been different now, but I'm the same way. I tell people I thank God every day that my leg broke, because with that
Yeah.
came so many great things after that. And
Oh,
I was
lots of blessings.
yes.
Lots of blessings. Yeah. And it's funny because people, they say, I think this is the best thing that ever happened to me. Having that
Mm,
accident was, I think, really a fortunate turn of events, and especially at such a young age, the appreciation I have for different things in life. I wouldn't be the person I am now if
mhm,
it weren't for that. And I think most people think, well, that's a crazy thing that we're
mhm.
grateful to have been in a bad accident or to have been injured. But it changes your life. It definitely changes your life for the better.
Mhm,
And you can become a victim, or you can be a survivor.
mhm,
And we get to choose that path, and to be that survivor, and to be strong and have the strength to share your story, and to share that tenacity.
mhm.
It definitely builds a lot of character, that's for sure.
Yeah,
So there's
definitely.
good things.
Well, awesome. So let's go on to Wilson Senior Living, because you talked about that a little bit. And um, how was that process in actually getting to, getting that idea of creating a senior living home, and then even um, developing it and constructing it, that whole process.
Yeah, I think that, my patience and the mission that we have to serve the community and take care of people,
Hmm.
it's so strong. And I've always wanted to to try and do whatever I can to help individuals and to find resources for them. And having a home in Kailua, there wasn't a resource like that previously. And the Windward side needed more long-term care options. And there's a lot of people that have grown up in that community and lived in that community their entire life. And for those individuals to be able to stay there was really important to me. And so identifying the property and finding, the team of individuals that helped to build and construct the home was very exciting. But I think also, just like we talked about, another risk or liability. And so in a lot of ways, it was scary as well, a huge financial investment for sure. But I think in being in business for such a long time, that was a challenge for sure. And, you hear about building permits and constructing things in Hawaii. And, I thought, wow, they're going to be so excited about this. DPP is going to love it. The community will love it because it's going to be so good for our kapuna and for everyone involved. But it's definitely not like that. And so I think that I had some uphill battles and again, being tested, but having such a powerful mission to take care of our community is what drives me. So I think that the fact that I'm very tenacious is certainly a good thing, but I won't be building any more commercial buildings in the near future, ever. But it was an interesting experience, and from every challenge and there's opportunity for growth. So I have a lot more character building from building and constructing that home, and all of the barriers and difficulties in constructing senior living, all of it's all worth it, because when I go there and I see the residents that are there now, that's what it's all about. A lot of them lived in the community in Kailua, and they get to stay there, and their loved ones live close by. So it's all worth it. I don't think about, I don't have nightmares about construction anymore. It's all a thing in the past.
I might, when if I ever get a studio, I might get nightmares for that. So we'll see. So kind of building off of that, also senior living, during this time of the coronavirus, a lot of differences, a lot of changes. What kind of changes has that, has the coronavirus affected your business in general?
Wow. We had been watching everything that was happening around the world, and also certainly throughout the nation. And, all of us in healthcare, we all knew that there was going to be a lot of transition and retooling of our processes. But I think for whatever sector you're in, you just don't know to what degree. And I have a lot of colleagues around the world that I communicate with that are in other business industries as well as healthcare. So, as much as you talk about it, it's very, very different when you're doing it, and that you're figuring it out as you go along. There isn't really a playbook for this particular pandemic, and I think not just for healthcare, but everyone, the state governments, the leaders in our communities, everyone is figuring this out as we go along. And it's very, very difficult. It's a moving target. And, it's something that I certainly was never prepared for. We have policies for nuclear disasters, and we have policies for pandemics, we have policies for everything, but it's not to this degree that we ever thought about it, because you don't know. The practical aspects of the day-to-day operations are very, very different. And so from a home care perspective, we have around 600 patients. And so figuring out how to protect our vulnerable patients as well as all of our staff, that was a completely different story versus I have a facility and I can control the entire facility and who comes and goes and sanitation and all of that. But in home care, it's a very different model. So from the very beginning, back in February, we issued masks to all of our patients as well as to our staff. So just to make sure that everyone was protected. And we also have some children, Keiki, that we care for, in addition to life support patients at home that are on ventilators. So very vulnerable folks, and trying to educate our team on how we needed to conduct business and how we needed to engage and interact with our family members in our patients' homes, as well as patients. So I think in the beginning, it was very scary for everyone to be issued a mask and all this PPE. We use PPE a lot, personal protective equipment. We use it a lot in our business, but not to the degree that we are now, where every single person must have PPE. So I think in the beginning, it was a real scary issue for our staff, but now it's much more, this is normal, this is regular, this is how we're operating. And then for senior living, we, because of all the things that have happened throughout the nation, and certainly the Kapuna long-term care, these facilities have had the most issue with individuals having outbreak and spread, and certainly a lot of death. And so we decided to be very aggressive from the beginning, and we had a team of nurses and caregivers that moved in to Wilson Senior Living, and basically we've been rotating people in and out on a regular basis, but the staff are living with the residents in Kailua now, and families visit, and they visit through the glass in the back patio, and they talk to their loved ones that way. And also there's a lot of new technology too, like the Zoom. Everyone is Zooming like we are right now. I never Zoomed before. We've never Zoomed before the pandemic, and now this is how we're having social hours and dinners and all kinds of things. But yeah, so some of our residents in senior living, they've never Skyped or Zoomed with their loved ones before, and so that's how they're engaging and interacting now. But it's definitely been a transition, and I think for healthcare there was a lot of information and a lot of requirements from Department of Health and Health and Human Services and the CDC, and there's recommendations left and right on a daily basis trying to get ahead of that. But also on the business side, there was a lot of information coming out at all of us as well. So drinking through the fire hose was certainly something that we all were doing together, and still transitioning as the pandemic ebbs and flows, right? It's going to ebb and flow as business starts to open up more, and we have people that are still going to get sick.
Yeah, definitely, and it's gonna live with us for a long time, maybe forever, honestly.
Yeah, I think people, it's human nature. Everyone wants to know, when can it go back to normal? And right now we have a new normal. This is our new normal, and leaving your home with a mask is going to be the new normal, where you think, oh, wait, I forgot my mask. This is part of my outfit. This is part of what I put on every day. And unfortunately, it is going to be part of our lives for a while. But everyone wants to know when it's going to end, and nobody knows that. And so trying to just maintain a sense of normalcy and find joy in every day is important. I think the mental health aspects of this pandemic may be far worse than the actual illness from COVID-19. It's sad that we all are humans by nature. We need to be hugged. We need to be loved. We need to spend time with one another. And I certainly see it in our patients that it's difficult to be isolated. But, I think for everyone to be cleaned up, and it's difficult. I hear little ones in your place right now.
I don't know what they're doing over there.
even for these little guys, right? These little guys, they want to go outside and go to the playground and wrestle with their friends, and now we're like, you see these kids at school, and we say, don't touch anybody, and that's not normal for any of us. We're social creatures by nature, and that I think the mental health aspects of it are difficult, more difficult maybe than all of the illness in general.
Yeah, I totally agree, because even doing these kinds of podcast episodes, I'm so used to recording in the space that the guest is in, wherever they are, their business or anything, and recording it through Zoom is a little awkward for me, just because I can't do kind of that same interaction like I have been doing for the past, I forgot how many episodes, but 20 something episodes. And but we got to make it work, and that interaction has to we yearn for that interaction. You know what I mean? So
and people have been very creative. There's some really fun stories and some fun things. Yet you have to find something on a daily basis to smile about or laugh about, or still find some kind of joy. If we all watch the news all day long and we really just thought about where the world is right now, it's a very, very sad situation. And there's a lot of doom and gloom. We have to find we have to find ways to still be happy and live your life. But like, to your point, we miss a lot of that engagement. When you're with someone, you feel their energy, and it's just a completely different experience. But it is what it is, and in order for us to really love each other and care for one another, we have to stay away from each other, which is so counterintuitive to everything that we know as people. Like, it's so funny. It's like, in order for me to care about you, got to stay away from me.
Got to put a glass in front of you. Yeah.
I love you. Here's the pane of glass.
Yeah, it's very strange. And I want to talk about, because you've been ahead of the curve for PPE and even social distancing from even January. I mean, you've been watching it for a while, and you've started 2 companies, basically. You started Be Well Hawaii and AlohaMask.com. Talk to us a little bit how that started and your whole purpose behind it.
Yeah, I think from from the healthcare perspective, and hearing from colleagues around the world, where countries were running out of supplies, and knowing that Hawaii was literally going to be the last place on the planet to get the virus, was kind of a eye-opening experience. And knowing, wow, if all these countries are already running out of supplies, and the United States is coming, And then Hawaii, if the US is going to be kind of the last place, wow, what's going to happen to Hawaii? Where are we going to find all of this necessary supply that's already oversourced? So I started buying PPE in abundance back in January. And there's an organization that I am a part of called the Young Presidents Organization, YPO. And it's a global group of young presidents. And we all collaborate together and help one another. And so I had some advantages in having these connections and relationships where they already know where sources are, or they have their own factories, and sharing those resources. And so and being able to collaborate with individuals that really support one another. So I was able to fly many products to Hawaii and kind of get ahead of it. And so knowing that some of my colleagues in Hawaii might need assistance or help at some point, in addition to the PPE that I would require with all the companies that we have now. And so I had no idea the needs that we would have here. And fortunately, I've been able to help quite a few people. And so there was never an idea to start a business specifically, but as the needs grew, and also sharing PPE with government agencies and state agencies and different groups in Hawaii, as well as companies, hospitals, healthcare facilities, small practitioners, even the mom and pop care homes that we've been able to help. So I needed to have this business entity in order to to help those individuals and sell our PPE supplies. And it's literally a cost. We're bringing the supplies in and all the shipping and the management and all that. And it's been provided to tens of thousands. We've literally flown supplies to the neighbor islands. All of the neighbor islands at this point, with the exception of Lanai, have received PPE from us. And it's fantastic that we have been able to help so many people, because it's a terrible feeling if you don't have the supplies and equipment necessary to protect your patients or protect your employees and your staff. So it's very, very stressful. And I've talked to many administrators and CEOs and individuals in leadership positions that are just at their wits' end trying to figure out how to get the supplies. So it's been wonderful to be able to provide that relief and support to so many in Hawaii. And including helping our partners and colleagues at the state level. It's it's been great, and everybody in Hawaii works so well together, supporting one another and being there for each other. So we started Be Well Hawaii, which is the medical supply company for healthcare providers and first responders. And then we actually have a website specifically just for that group, password protected. So you have to have a medical license or healthcare license to purchase the PPE from that company. And the medical grade PPE, like the N95 masks and some of the higher grade equipment and supplies that the business community doesn't need that. So that's one of the needs that grew out of this crisis. And then we started receiving requests from the business community to open up their businesses safely and to have some guidance and access to non-medical PPE. And then, of course, there's a lot of people that are vulnerable. They can't leave their homes. Where are they going to find a mask or hand sanitizer or disinfectant? So we started AlohaMask.com to help to serve that population as well. And for the business community, there's no book for them either, in how to specifically address the challenges or areas in their industry, whatever they, type of business you have. So on the website, there's also a tab for Learn, and there's some great resources there for different types of businesses to go through a checklist of things they can go through to cover themselves and to kind of come up with their policies and educate staff and figure out their new normal in operating their businesses. And we have some business bundles to start to give people the basics that they might need: the infrared thermometers and 3-ply disposable masks, the KN95 masks. There's a variety of different things for companies and certainly individuals. We've been mailing masks to people's homes for the last, we launched the company just a couple of weeks ago. But it's kind of nice. I know I order stuff through Amazon now, and it takes a long time to get supplies, a lot longer than it used to. And so it's nice that we have supplies locally to be able to mail out to individuals' homes, and they receive it within just a couple of days. So a convenience, and it's very affordable. There's not a lot of cost to the supplies that we're providing. Yeah.
And I like that it's available, especially on island. I mean, some people, they probably order it through Amazon and it comes 2 months later, what I mean? Which is insane. But all your equipment is readily accessible, and people can just go to the website, which is alohamask.com, and they can there's a ton of products. There's good just personal bundles too, there's family bundles, there's back to business bundles, which I think is really good. It's a really good idea for people to know what they need in order to stay protected during this time. And
it's all about health. It's all about health and safety. And I think that initially, when I first gave masks to my staff, I told them, this is love. This mask I'm giving you is because I care about you. I want you to be safe. I don't want you to get sick. And that's what the mask means. We all are caring for each other, and it's going to keep you safe and healthy. And I know that there's still some individuals in our community that struggle with the reality of the situation, but it is what it is. And in order for you to stay healthy, you have to wear a mask. You really do.
And it's good too, because for businesses that are transitioning, opening up again, having the correct equipment and allows them to open up again, and allows them to have customers and even families to even go out and enjoy going to the park and stuff. And I mean, we were talking about how people yearn for interaction, and the PPE that you're providing allows people to have that interaction and allows people to adjust to the new normal during this whole time.
Yeah, and I think that there's a lot of individuals that still don't know, where to go, what they need, how to get it. So it's kind of nice that there's a one-stop shop. We have, and there's no limit. I think you go to Costco, you can only buy one thing of toilet paper or one thing of hand sanitizer if you can get your hands on it. But yeah, we have plenty of suppliers right now for hand sanitizer and masks and disinfectant. So they're all basic things, but I think in this current day and age, we're all desperate. If you saw a canister of Clorox bleach wipes, people are tackling one another to get a thing of Clorox bleach wipes. Or the things that we find exciting now. Oh my gosh, gel hand sanitizer is so luxurious, because we only had liquid hand sanitizer for the longest time. And now my staff are like, Oh wow, the gel is very, very nice. We're all so excited. I'm like, I can't believe it's the things that make us give us satisfaction now,
Hmm.
and or even the masks. We have some colored 3-ply disposable masks, and now it's
Mm,
like, would you like a pink one or would you like a black one? Or
mm.
it's kind of funny that these are the conversations that we have now in our community, but it's going to be with us for a while, and being able to have access to the equipment and supplies to keep everyone safe and healthy and able
Mhm,
to open up their businesses is very, very important. And I know for a lot of our doctors here in Hawaii, people don't think about it, but these small practitioners or dental practices,
mhm,
this is their entire life. They have to be able to get back to business, and they need to have these supplies, and it's very difficult when you're a smaller company or a smaller entity to get the supplies because you can't buy in bulk. So
mm.
it's yeah, it's been a privilege to be able to help so many people, and I've been offered a lot of root canals by the dentist locally. So I'm covered. If I ever have any dental dental needs, I
That's
feel
awesome.
really, really good about about the situation. So there's always a silver lining, right, to
Mhm.
every crisis. Yeah.
That's awesome. I was just thinking about like Black Friday shopping. Like if you know for Black Friday shopping there might be a whole case of wipes, and then people are just gonna go crazy
Oh,
for
totally. Or, stocking stuffers are going to be these no touch tools that I have on the web. I thought,
yeah.
these are going to be stocking stuffers for this Christmas, which is a sad thing. It's a very
Mhm,
sad thing that's what we're dealing with. But you
mhm.
have to find some humor and have a little levity in this situation. So yeah, stocking stuffers will be very different. Hand sanitizer, 2-ounce hand sanitizers are going to be a hot item at Christmas.
Disinfectant spray like the ones on your website. Oh, I'm gonna
Oh
be.
yeah, yeah. You're gonna see all kinds of different gifts that people are sending to one another, and
Mhm,
yeah, even with our how we are getting food
mm,
delivery is such a big deal that a gift card or a certificate to have food delivered is like a big deal.
mhm.
So yeah, the way in which we are living is definitely changing.
So let's talk about I want to talk about mission first responders because it's an initiative also with supporting first responders in general, those that are on the front line, and like you were saying, doctors that are opening up their business and really trying to adjust to the new normal and really trying to survive this pandemic. I think that's a big thing. Talk about mission first responders for us.
Yeah, so initially, my staff and I came up with this idea to really highlight and focus on the healthcare community and
Hmm.
the first responders in Hawaii, the police, the firefighters, the ambulance folks. We wanted individuals to realize, the critical nature of personal protective equipment and how important that is for these individuals to stay
Hmm.
safe and healthy, and also to continue to serve the community. And it's very, very vital and very important that they have the medical grade PPE necessary. And I
Hmm.
think a lot of people, think that these hospitals have, all of this government funding and money coming in, but it's a struggle. They are not accustomed to, none of us in healthcare are accustomed to having to spend this kind of money on personal protective equipment for all of our staff. It's a lot of investment and money, and you see hospitals across the globe that are going bankrupt and they're going under. And we must have access to healthcare in Hawaii. We must keep our hospitals healthy and here and healthy financially, as well as staff healthy and not getting sick, so that we have individuals that can care for us in the community when we do get sick. So just this awareness, I think it started with an idea of wanting to spread that knowledge and information, and then it turned into a platform for us to help raise some money to provide PPE to our local hospitals and first responders. And Flash and Maleko, with their Living Room Live program for the last 11 weeks, have been instrumental in helping to highlight mission first responders, in addition to the food bank and food drive, as well as Henry Capono and his initiatives in highlighting the musicians' needs and challenges during this crisis. So yeah, Flash and Maleko were fantastic, and we all came together to help to raise over $30,000 for 9 facilities in Hawaii. And in the next several weeks, we'll be delivering PPE of their choice to their facilities. And it's a small amount. Each facility will have $4,500 to contribute to their PPE supplies. But again, it's the awareness that we've helped to create. And also, the other side of it, an unintended blessing, I guess, is we heard so many stories from people about their past and their interactions, individuals that had been taken by ambulance to one of the hospitals and had this amazing person that saved their life, or they had a great interaction with a police officer or retired firefighter or loved one of a first responder. And the stories that came out of the GoFundMe part of it was really endearing. I think, just hearing about how people have just been so touched and connected to somebody on the front lines in Hawaii has been fantastic. And I think that part of the pandemic and part of the story of this tragedy is also that highlighting the healthcare workers that really are risking their lives for us every day, and the first responders that are on the front line. And we think about people risking their lives that might get shot. Well, of course, that's an obvious thing, but people that are risking their lives that might get sick and not do so well, that's a different mindset than we've ever been accustomed to. And I think also maybe another positive from this has just been highlighting our kapuna and the seniors and elderly across our nation or across our world. And we know that everyone loves their grandmas and grandpas, but we just maybe don't take enough time to stop and love and appreciate and think about our seniors and the world that they created for all of us, and the blessings that they've provided to all of us. And I think this newfound appreciation for elderly around the world has just been really awesome and really positive. And a lot of my seniors and patients, they're receiving more phone calls and more interaction than they ever have. And I think that's a positive. That's certainly been very uplifting. It's just creating that newfound awareness for our grandmas and grandpas too.
Yeah, definitely. There's a new appreciation, new mindset for people we probably never thought about in a while.
Yeah.
And I think about, my cousin is a dermatologist and his business going forward, but also the impact that he has on his community and how to be safe. A lot of people have been asking about how to, practice social distancing and what they should be doing. And, just seeing him connect with other doctors that are doing similar practices, not even dermatology, but even going into, orthopedic or other types of practices, how they handle the situations. And we forget that these people are on the front lines, and they're at risk all the time.
Mm-hmm.
Even before the pandemic, they were at risk of getting sick, and who knows what they could have contracted. But
Yeah.
then, especially now, it's important that we remember, um, our friends who are doctors, or even just
Mm-hmm.
our doctors in general, and
Yeah.
even our
No,
loved
and
ones.
the
Hmm.
healthcare community, yeah, I think it's a different conversation now, and it
Hmm.
frames the subject in a different way.
Hmm.
And before, getting sick was, oh, you caught a cold, or
Hmm.
it was flu season. But this is certainly at a different level. But
Hmm.
yeah, just a newfound appreciation, like you said, and awareness of these these types of occupations that maybe
Hmm.
we take for granted. And like you said, even the dermatologist, the dentist, everybody that is there to provide this necessary service and healthcare for us,
Hmm.
is so important. And also, our firefighters and police officers,
Hmm.
there were some firefighters that got sick very early on, and we had to close a station. Now, having those kinds of resources available, because we're still going to have the regular emergencies that we've always had.
Hmm.
We have to make sure that those individuals that are keeping us safe are healthy as well. So it's just a completely different life that we're all living right now. And
Hmm.
it brings up a lot of new questions and new conversations. And as people try to figure it out for themselves and their loved ones and their businesses, we'll all come up with new creative solutions to help address it together.
Hmm. Definitely. So, as some lasting remarks, what would you want to tell our audience today about, how to move forward, or even what they should be thinking, maybe like mental health wise, or even just how to move forward?
Yeah, I think that it's important for people to stay vigilant in washing hands and infection control practices and social distancing. And I think as we start to move to open up the community more and more, and the visitor industry is next, it's easy to feel like we're back to normal and it's an all clear,
Mm.
but it's not. And we will see. There will be spikes in COVID-19 cases, and it will ebb and flow. I think people keep wanting to figure out the second wave and how many waves, but it doesn't matter.
Hmm.
It's going to ebb and flow. We're not going to have 19 waves or 37 waves. It will just be our new normal. We're gonna have this virus around for a while, and we all need to wear masks when we're out. As much as we want to hug, and people still, I think your natural instinct, because we hug in Hawaii, we don't
Hmm.
we don't shake hands. We gotta all hug each other. Your natural instinct when you see someone is to lean in,
Hmm.
and we just can't. We have to forgo that for now. But I think just maintaining this sense of vigilance in staying steadfast while this virus takes its course. And
Hmm.
hopefully we'll get a vaccine here at some point or another. And even when we do get a vaccine, it's going to take some time for us to get everyone inoculated. So, we just have to stay patient, find something that brings you joy every day. Talk to your loved ones. Take the time to do these fun little Zoom cocktails and dinner parties. And there's so many cute things that people are doing. And,
Hmm.
spending more time with your children, and, connecting. We're connecting in a different way than we've ever connected before. So I think there's a lot of positives, a lot of silver linings. And make sure that you call your grandparents and that you send them a letter. They love letters, and spend as much time as you can in cherishing and honoring our kupuna, and also our healthcare workers. Thank those folks on the front lines whenever you can. But yeah, everybody in Hawaii, we're very, very fortunate to live in this beautiful place where people really do come out for one another. Everybody's helping to find ways to bring food donations and take care of our friends and neighbors that are suffering. And, I think in a situation like this, it just brings to light more the aloha spirit and how fortunate we are to live in such an amazing place where we're all so connected.
Definitely. Once again, Shelley, thank you for joining us here on the show. And just for our audience here, how can people find you, as well as maybe the different initiatives and businesses that you're promoting?
Yeah, so Wilson Care Group, they can find us at wilsoncare.com is the website for our healthcare companies. And we also are hiring right now. We have some nursing positions as well as caregiving positions available. And then alohamask.com is where individuals can find the non-medical PPE for their businesses and certainly for their families. And if there are healthcare practitioners that still need medical PPE, they can call our office at 596-4486. And we'll give them the password for bewellhawaii.com. Yeah.
Awesome. Thank you again, Shelley, for joining us. And guys, just stay safe out there, stay blessed, stay positive. I think that's a very important thing, because it's easy to get negative in a space, by yourself. But, try to connect with people as much as possible in your capacity, of course. And like I said, just stay positive out there. Anyways, thanks guys for joining us. Hope you guys have a great day. And stay blessed. Stay tuned for another episode later on.